A cough, a shadow, a life on the edge. This is the true story of how one man thought he was dying of lung cancer. And his story begins with a cough. A dry, raspy, stubborn little cough that just wouldn't quit. At first, 37-year-old Zhang thought it was nothing. Maybe the smog, maybe the late-night spicy noodles, maybe, probably, the 3 cigarettes he smoked every morning on his balcony before work. His girlfriend May had been nagging him for months to quit smoking. "You'll regret it," she'd say, arms crossed, standing in the kitchen like a prophet of doom. He always laughed her off. "I'm too young to die." Then came the fatigue, shortness of breath, a weird pressure in his chest, like someone had placed a sleepy cat on his lungs. May wasn't laughing anymore. Now, Zhang wasn't the kind of guy to run to the doctor. No. He had something far more powerful, the internet. So he did what millions do when they feel something's off. He Googled it. Cough plus chest pain plus fatigue plus smoking plus male plus age 30s. The results came fast, and they were terrifying. Possible conditions: lung cancer, pulmonary fibrosis, tuberculosis. Zhang fell into a rabbit hole of symptom checkers and health forums. He watched YouTube videos of former smokers with oxygen tanks. He bookmarked articles titled, "The 10 Warning Signs of Lung Cancer You Must Not Ignore." He even bought herbal teas, detox drinks, lung cleansing patches from a sketchy online store. Nothing worked. The cough got worse. May finally gave him an ultimatum. "Doctor, tomorrow, or we're done." At the hospital, things moved quickly. Chest x-rays, CT scans, blood tests. Doctors gathered around his scan like scientists studying a meteorite. "Your lungs are cloudy," one doctor said. "Suspicious masses," another added. "Could be malignant." Zhang froze. He wasn't breathing right. Maybe it was the panic, or maybe the oxygen levels. May covered her mouth. "Is it cancer?" "We can't confirm without a biopsy," the doctor replied. "But it's very likely. We'll admit him for further observation." And just like that, Zhang was wheeled into a ward, mentally preparing for chemotherapy, radiation, and making peace with his ancestors. But something didn't sit right. His oxygen levels were dropping. But he was young, fit. He'd never had this kind of immune crash before. His white blood cell count wasn't that high. And oddly enough, he had no weight loss, no fever, no night sweats, the usual red flags of cancer. So they sent his lung fluid for further testing. Cultures, fungal stains, PCR sequencing. And 3 days later, the real twist arrived. "The lab results are back," the pulmonologist said. "It's not cancer, it's a fungal infection." "A fungus?" Zhang blinked. "In my lungs?" "Yes. Trichophyton mentagrophytes," the doctor replied. "What the hell is that?" May asked. The doctor pulled up a medical article on his tablet. "It's a fungus commonly found in shoes and socks." The room went quiet. Zhang's eyes widened. Suddenly, it all clicked. Zhang sat up in bed, mortified. There was something he hadn't told the doctors, not even May. You see, Zhang had a weird little ritual. After a long day at work, he'd take off his shoes, peel off his socks, and sniff them. Not a quick whiff. No, a deep inhale. A weird, guilty, comforting habit. He said it helped him relax. Some people meditate. Some people drink tea. Zhang sniffed socks. Every day. And one day, He had a minor foot fungus, itchy, barely noticeable. The spores made their way into the socks, then into the lungs. Every sniff, a tiny fungal bomb. What Zhang had was a pulmonary fungal infection caused by inhaling dermatophyte spores, typically found on the feet. While skin infections from trichophyton are common, like athlete's foot, deep lung infections from the same fungus are extremely rare. But possible, especially with repeated, prolonged exposure. Like Zhang's sock-sniffing ritual. Doctors were stunned. Mei was speechless. Zhang wanted to disappear into his hospital blanket. Fortunately, the infection was caught early. Zhang was put on antifungal medication, oral itraconazole, and responded well. His cough subsided. His lung scans started clearing up. He stayed in the hospital for 2 weeks, long enough to recover, and long enough to swear off 2 things forever: cigarettes and socks. Mei, to her credit, stayed with him the whole time. She still brings it up at every dinner party. He thought it was lung cancer. Turned out it was just athlete's foot in the lungs. So what do we take from Zhang's story? Don't rely on WebMD. Don't ignore real doctors. And maybe, just maybe, don't sniff your socks like they're lavender incense. Because sometimes the real danger isn't in the cigarettes or the pollution. It's hiding in your laundry basket.